Isn't it just wild sometimes how things turn out? I mean, you always assume the biggest, most powerful AI model is going to be the best one, right?
Yeah, that's the usual thinking.
But then this news drops, a smaller AI, GPT 4.1 Nano, apparently cheaper too, actually did better than the big flagship GPT 4.0 on a really important healthcare test.
It really makes you stop and think, doesn't it? And it perfectly highlights why we need, well, really solid ways to measure how these AIs are actually performing, especially somewhere like healthcare.
Exactly.
And that's precisely what we're diving into today.
Uh,
We've got some really interesting research here, all focused on this new benchmark called HealthBench.
Right, HealthBench. So if you're someone who wants to get up to speed on AI in healthcare, like really understand what's going on without reading stacks of papers, this is for you.
Yeah.
We're basically pulling out the key stuff from this HealthBench study.
Yeah, trying to give you that shortcut to being well-informed.
Yeah.
And HealthBench itself, it's quite something. It's open source, which is great.
Mhm.
And the whole point is to measure performance and safety. It does this using these very realistic conversations, multiple turns back and forth.
Okay, so not just single questions, like a proper dialogue.
Exactly. Simulating how someone might actually talk to a doctor or a health professional. We're talking scale here.
Oh, yeah.
5,000 of these conversations. And get this, they're evaluated against over 48,000 unique criteria, all looked at by physicians.
Wow, 48,000 criteria. That's incredibly detailed.
It is. So our mission for this deep dive is really to unpack what HealthBench is telling us. Where does AI in healthcare stand right now? How far have we come? And crucially, what are the big hurdles still ahead?
Okay, sounds good. So before HealthBench arrived on the scene, how were people even checking if these AIs were, any good for health stuff? What was wrong with the old ways?
Yeah, that's fundamental. The HealthBench creators basically said existing methods often miss the mark. They talk about three main problems: not being meaningful enough for the real world.
It's not always trustworthy, lacking that solid medical expert validation,
Right.
and maybe surprisingly, often unsaturated.
Unsaturated, what does that mean exactly? Like, the tests weren't hard enough.
Precisely, yeah. They weren't really pushing the models to their limits. Think about using multiple choice tests, like a med school exam for an AI,
Okay, I can see that.
or maybe focusing on really narrow clinical questions. But real healthcare, it's messy, right? It's open-ended conversations, nuanced context.
Yeah, definitely not multiple choice.
So scoring high in those older tests didn't necessarily mean an AI was actually ready to be helpful or safe in a real clinical setting.
That makes total sense. And the trustworthy part, not enough doctors involved.
Often, yeah. Or the validation wasn't rigorous enough. An AI might give a technically correct answer, but would a group of doctors agree with how it communicated or if it missed something important? That expert consensus piece was often weak.
Gotcha. Okay, so HealthBench sets out to fix all this. How did they approach it? What's different? The core idea was realism and grounding it firmly in medical expertise. So a huge part was involving the medical community directly. They worked with 262 physicians across 26 different specialties from 60 countries.
Wow, 262 doctors. That's a serious panel. And global, too.
Absolutely. That diversity is key for relevance. And these doctors weren't just advisors, they were hands-on. They helped design those realistic conversations we mentioned.
Simulated dialogues.
Exactly. And then crucially, for each conversation, physicians wrote detailed, specific rubrics, like a custom scoring guide just for that interaction.
Ah, so not just a generic checklist. Each conversation gets its own evaluation framework.
Precisely. These rubrics cover everything, factual accuracy, of course, but also communication style, empathy, clarity, even identifying common misconceptions the AI shouldn't repeat. That's how you get to over 48,000 individual evaluation points. And the scoring, it's not just about getting points. Models can actually lose points, get negative scores if they give harmful or incorrect advice.
Negative scores. Okay, that definitely raises the stakes for the AI. So how does the grading actually work? Do all 262 doctors read every single AI response?
No, that wouldn't be feasible with 5,000 conversations. They developed something called a model-based grader.
Okay.
Essentially, they trained another AI model. They taught it to apply those physician-created rubrics consistently and accurately.
Whoa. Okay, so they use an AI trained by doctors to grade the other AIs.
Exactly. It allows for that scale while still being anchored in physician judgment. And to get even more granular, HealthBench breaks down performance by themes and axes.
Themes and axes.
Yeah, think of themes as different healthcare topics like emergencies or global health questions or tasks involving data. And axes are the qualities being judged like accuracy, completeness, communication quality, things like that.
Okay, that makes sense. So you can see where and how the models are doing well or poorly.
Yeah.
So with this whole setup, realistic chats, doctor-designed rubrics, AI grading, themes, axes, what did they actually find out when they tested the models? What are the big takeaways?
Well, one of the absolute headline findings is just the sheer speed of improvement recently. It's been quite dramatic.
Really? How dramatic?
So they mentioned GPT 3.5 turbo scoring around 16% on HealthBench a couple of years back. Then GPT 4.0 hit about 32%. But some of the latest models they tested, like one called O3, are hitting scores around 60%.
60%? Wow, that's a huge leap from 16% or even 32%, almost doubled performance recently.
It's really significant progress in a short time. And then there's that surprising result we started with.
Ah, yes, the smaller model doing better, GPT 4.1 Nano.
Exactly. That's another crucial finding. Not only did it outperform the larger GPT 4.0, but it did so while being massively cheaper to run. They estimate something like 25 times cheaper computationally.
25 times. That's incredible.
It really is. It suggests we might not always need the absolute biggest model for top performance in specific areas like this. Smaller, more efficient models are catching up fast.
That has huge implications for actually using this stuff, right? Accessibility, cost.
Absolutely, especially in healthcare settings where resources can be tight. Now, about those themes, how did performance vary across different types of health scenarios?
Yeah, good question. Where did they shine and where did they struggle?
They generally scored higher on things like identifying emergencies and guiding users on what to do next. Also, tailoring communication based on how much the user seems to know medically.
Okay, that sounds useful.
But they struggled more with themes needing deeper understanding, things like knowing when to ask for more information, context seeking, or handling complex health data tasks. And also global health scenarios, which often need awareness of different resources or practices.
So they're okay at spotting a potential crisis, but maybe not as good at the nuanced investigation, like asking the right follow-up questions?
That seems to be the pattern, yeah. It really highlights where more work is needed. And looking at the axes, the quality measures, you see a similar thing.
How so?
Lower scores generally on completeness and context awareness. They did better on accuracy, communication, and following instructions.
So getting the facts right and sounding okay, but maybe missing the bigger picture or not giving the whole story.
Kind of. Though they did note that the very latest models showed some decent improvements, specifically on completeness, which is promising.
Okay, so progress there, but context is still tricky. Now, you mentioned cost before with a Neto model. How does HealthBench help compare performance versus the cost of running these models?
Right. They looked at this through the lens of the Pareto frontier.
Okay, explain that.
So imagine a graph plotting performance against cost. The Pareto frontier represents the best possible performance you can get for any given cost level. You want to be on that frontier maximum bang for your buck, essentially.
Got it. Best value.
And their analysis showed that the newer OpenAI models from April 2025, like O3, O4 Mini, and that GPT 4.1 Nano define a new, much better Pareto frontier. Meaning, you can now get significantly higher performance for the same costs or the same performance for much lower costs compared to older models. Especially those smaller models, they've really pushed that frontier forward in terms of cost effectiveness.
That's a really key point for anyone thinking about deploying these. Better performance without breaking the bank, potentially. Did they mention ways to potentially boost performance even more, maybe besides just bigger models?
Yes, they touched on giving the AI more thinking time, essentially, using techniques like chain of thought reasoning.
Chain of thought, like talking itself through the problem.
Kind of, yeah. The model explicitly breaks down its reasoning step by step before giving the final answer. The idea is this allows it to double-check facts, consider alternatives, spot missing info, and generally arrive at a more robust conclusion for complex tasks like those in HealthBench.
Makes sense, like showing your work in math class, but for the AI.
Okay, shifting gears slightly, reliability. Hugely important in healthcare. How did HealthBench look at that? Not just average performance, but avoiding bad mistakes. Absolutely crucial. They used a metric called worst at K performance.
Worst at K.
Yeah, imagine you run the same prompt, say, 16 times. What's the worst score you get across those 16 tries? That's your worst at 16 score. It tells you about the model's consistency in avoiding really poor responses, not just its average.
Ah, okay. So it's looking for those potential catastrophic failures, even if they're rare.
Exactly. You don't want an AI that's right 95% of the time, but dangerously wrong the other 5%.
So what did they find on reliability?
Well, the newer models are definitely more reliable than older ones. Their worst at K scores are better. But and this is important, even the top frontier models still show significant room for improvement here. Their average scores might be high, but their worst-case scores can still dip quite low sometimes, meaning they aren't perfectly consistent yet at avoiding those suboptimal answers. Reliability is still a major challenge.
Okay, so progress but not solved. What about the benchmark itself? Are the questions mostly easy, hard, a mix?
It seems to be a pretty good mix, leaning towards moderately difficult. They found very few problems that were, like, trivially easy for all models, and also very few that were basically impossible for even the best ones.
So it's hitting a sweet spot, challenging enough to show differences and track progress.
Exactly. It means HealthBench should remain useful for measuring improvements for some time to come. It's not saturated in that sense we talked about earlier.
Good. Now, a common concern with AI evaluation is response length. Could models just be scoring higher because they write longer answers? Did they look into that?
They did, yeah. It's a valid point.
Yeah.
But they found for most models, there was only a pretty weak correlation between how long the response was and the actual HealthBench score.
Oh, interesting.
So just being more verbose doesn't seem to be the main reason for higher scores. They also did head-to-head comparisons, win rate analysis between models controlling for length, and the better models still came out on top.
Okay, so it seems like the improvements are more about the actual quality and accuracy of the information, not just padding the answers.
That's what the data suggests, yeah. Quality over quantity, mostly.
Good to know. Now, you mentioned HealthBench has these special subsets, consensus and hard. What are those about?
Right. So HealthBench consensus focuses on a core set of really critical criteria, especially for high-stakes things like emergency advice. These criteria went through extra validation by multiple doctors to ensure super high agreement on their importance.
Okay, like the absolutely must get right stuff.
Pretty much. And the good news is, on these consensus criteria, error rates dropped significantly with the newer models, especially for emergencies. But they still flag areas needing work, like, again, context seeking, handling uncertainty well, and response depth.
Still some gaps, even in the high consensus areas. And HealthBench hard sounds tough.
It is. It's a set of 1,000 examples specifically chosen because they're really difficult. Even the best models right now score pretty low on a HealthBench. Hard, the top score they saw was only around 32%.
Only 32%. Wow.
Yeah. So HealthBench Hard really represents the frontier, the big challenges for future AI development in this space. It shows where the toughest problems still lie.
A benchmark for the bleeding edge. Now, didn't they also compare the AI to actual human doctors doing the same tasks?
Yes, they did. They had physicians write responses for HealthBench scenarios. Some doctors did it from scratch with no AI help. Others were shown AI responses, sometimes from older models, sometimes from the latest ones, and asked to improve them.
And what happened there?
Really interesting results. Physicians could improve on the responses from the September 2024 AI models, but when they were given responses from the April 2025 models, the really top-performing ones, the physicians generally couldn't make significant improvements.
Wait, really? Doctors couldn't improve on the best AI's answers?
In many cases, no. It suggests these latest models are reaching a level of performance in these specific conversational tasks that's comparable to, or at least very hard to beat by, human experts.
That's quite a finding. A bit humbling, maybe.
It definitely highlights the potential, yeah. But what about the doctors who had no AI help? How did they score?
Right.
Their scores were generally a bit lower than the AI-assisted ones, but the researchers added a caveat here.
Oh.
This task-writing chatbot-style responses isn't really how doctors normally communicate or work. Plus, their unassisted responses tended to be shorter, which might have affected scores. So it's maybe not a perfect apples-to-apples comparison of clinical skill itself.
Okay, fair point. Different format, different context. Now, back to the grading. Since an AI is doing the scoring based on the rubrics, how certain are we that the grader AI is doing a good job?
Right.
Is the evaluation trustworthy?
Critical question. They did what they call a meta-evaluation to check this.
Meta-evaluation. Evaluating the evaluation.
Exactly. They took those high-agreement HealthBench consensus criteria. They had both the AI grader and multiple physicians score the same AI responses. And then they compared. How well does the AI grader agree with the doctors? And how well did the doctors agree with each other?
Ah, clever. Using human agreement as the benchmark for the AI grader.
Precisely. And the results were pretty positive. They found the GTT 4.1 base grader achieved agreement levels with the physicians that were very similar to the agreement levels between different physicians across most of the themes.
Okay, so the AI grader seems reliable, mimicking physician judgment pretty well. That builds confidence in the overall results.
It does. It suggests the automated grading is a valid approach here.
One last check: consistency. If you run the tests multiple times, do the scores jump around a lot or are they stable?
Good question for any benchmark. They tested this, running evaluations 16 times for several models. They found very low variation, a low standard deviation in the overall scores.
So HealthBench gives stable, repeatable results.
It seems so, yeah. Which is what you want for reliable tracking of progress over time.
Okay, so let's try and wrap this all up. We've gone through how HealthBench works, what it measures, the key findings. What are the main insights you'd want someone listening to take away from this deep dive?
I think there are a few key things. First, HealthBench itself is a big step forward. It gives us a much more realistic, trustworthy, physician-grounded way to see how AI is doing in healthcare.
Right, better measurements.
Second, the progress is undeniably rapid, especially recently. Models are getting significantly better at these complex conversational tasks. Third, however, major challenges remain. Things like deeper reasoning, consistent reliability, avoiding those worst-case scenarios, and handling nuances like context seeking and global health variations still need a lot of work.
So fast progress, but still miles to go in some areas.
Exactly. And fourth, that finding about smaller, cheaper models like GPT 4.1 nano keeping pace or even outperforming larger ones is really significant. It changes the game for cost effectiveness and accessibility.
Yeah, that one really stood out.
And finally, the fact that it's open source is huge. It lets everyone see how it works, use it, build on it. That can really help push standards forward for developing AI safely and effectively in healthcare.
Absolutely. It's been really illuminating digging into this. And it leaves you thinking, doesn't it? Seeing this incredibly fast progress, AI getting close to or sometimes matching expert performance on these specific tasks, it forces us to confront the big questions. What are the real practical hurdles, the ethical guardrails we absolutely need to get right as we start weaving this technology more deeply into actual healthcare delivery for everyone? And how will tools like HealthBench guide us in making those crucial decisions wisely? Definitely a lot to ponder there. Thanks so much for breaking all that down.
My pleasure. It's a fascinating and incredibly important area to watch.